You know what my grandma told me the other day? She's like, you know what I realized? No man has ever kissed my feet. I was like, why are you telling me this?
Hi Kimberly, what brings you in today?
So I keep having my reoccurring lower back injury that I had from CrossFit, where my sacrum like keeps shifting to the left and it keeps on pinching on, I think, my sciatic nerve.
Kimberly has been a patient of mine for some time. She came in to see me today. She's always suffered from chronic low back pain. She's maintained it through fitness and core exercises. She had the most recent reoccurrence just a few days ago in CrossFit doing deadlifts. The pain was pretty intense on her left side, travels down her leg. So she came in to see me to see what we could do to get her some relief. Stay put. How long did you injure it at CrossFit?
The beginning of this week.
And you're feeling it on your left-hand side?
Yes.
All right, on your sacrum, right about here.
Yes.
Okay, so that is your SI joint, and it does feel a little more boggy and swollen than the right side, so good job in self-diagnosing. Let's have you go ahead and stand up.
Okay.
Can you flex forward and touch your toes? Do you have pain?
Yeah.
Okay, don't do it then. So basically, Kimberly couldn't even flex forward to touch her toes because the pain was so intense. Her left side of her low back muscle spasmed, causing the nerve to be pinched because the bones were out of place.
That happened after I did a deadlift.
Oh, did you hear a pop or anything?
I felt like kind of like a jolt, like after I got done lifting and I dropped the weight, and so after that I just was walking around
You're like, oh no.
Yeah.
Okay. So, does the pain travel down the backside
Yes.
of your leg?
Yeah.
How far?
It'll probably go to like probably where my heel is at.
Oh wow, it's traveling all the way down.
Yeah.
Okay. All right. Let's go face down. Okay, here we go. And go ahead and just relax. Hands to the floor. Okay, I'm going to bring this up a little bit. All right, your left is short, your right is long.
Okay.
We can't go by the shoes itself, so I go by your malleoli,
Okay.
your ankle bone. Are you in pain just laying here?
I felt it pinch right now.
Okay, let me bring this up. Does that help?
Yes.
Okay. Do you mind if I expose your low back?
No.
Okay, so let's kind of see what's going on here. So right in here.
Yeah.
Okay. All right. I am going to use my gua sha tool doing the Graston technique to kind of break up this area. If it's too tender, let me know.
Okay.
And in doing that, I'm going to do a little cupping, pull some stuff out, and then we'll get to your adjustment.
Okay.
Have you done CrossFit since?
Yes.
Nothing's going to stop me.
And then since I, like working at the hospital, like I'm moving patients and pushing carts and
You have to
burning.
physically move them?
Yeah.
Okay.
Oh, it feels good.
Okay, good. Just enjoy that. Have you been wearing a low back support or anything?
No, I probably should invest in one.
Yeah, there's some good ones, and especially since your job is physical, you would probably benefit from having that extra support. Definitely at work. So what I'm doing is I'm breaking up any of that fascia under the skin
Okay.
that is creating this muscle to be tight. Since this is your short leg. And then I'm gonna pull it all to the surface with the cupping.
that technique that you showed me a while back, that's actually helped me in between when I have to see you, so thank you.
Are you talking about the exercise?
Yeah.
Which one?
The tilting my pelvic.
Yes.
That one.
We can go over that again.
Yeah.
Absolutely, because as fast as you can get knocked out of place, you can oscillate it back into place sometimes. You okay with this? You're going to have some reddening, maybe a little discoloration back here.
That's fine.
So where do you take CrossFit?
On Mission Street.
Oh, how do you like it?
I love it. I've been there since 2017.
Oh wow, for a while.
Yeah.
And it's outdoors?
Yes.
Nice.
Good community.
What time do you go? Do you have
No.
a set time?
Yeah, 9 a.m. is the one I can make, where I don't have to wake up too early and get enough sleep.
I know, there's so many people that get up at 5 and go, and I'm like, oh my gosh.
Yes. I'm like, are you?
Good for them.
Yeah, for reals. I'm like, no, that's okay. No.
I'll do the 10 a.m. class.
If there was, I would, girl. I'm like, 9? Come on, you guys.
Alright. I'm going to do a different cupping on you today than the silicone. Is that right where it is?
Mm-hmm.
Was that tender or tickly?
Tickly.
Sorry.
No, it's fine.
Okay.
Can you suck the fat out while you're doing
Stop
this?
You do not have any fat. Okay. We're gonna let that sit for a moment.
Okay.
Does that feel okay?
That feels good.
When I do cupping on patients, I tend to put a little bit of oil or lotion to lubricate the skin, because I like to place the cups on the affected area, and then I, over time, move the cups around to get a greater area of relief for the patient. Have you been running?
I try not to, so I've actually been more on the bike to get the cardio.
Okay.
Yeah.
Just this week?
Yes.
Because normally you'll run when
Yeah.
this feels better?
Yes.
Okay.
Yeah, I'll alternate between a weightlifting day and then the next day will be cardio.
All right. How far are you riding?
On average, like 5 to 6 miles.
Okay.
Yeah.
Are you on a stationary or a
Yeah, on
bike?
a stationary.
Okay.
I want to get a bike.
We're gonna get some good coloration on you, hopefully. Polka dots. So are you sleeping on your back with a pillow under your knees, on your side?
I do start with having the pillow underneath. I do remember you telling me about that, but I end up moving around so much that sometimes most of the time I end up sleeping on my side.
Okay.
Yeah. But the firm mattress makes a difference.
Oh my gosh.
A lot of people complain about my bed. They're like, it's so hard. And I was like, just get used to it. And then they're like, hey, my back feels supported.
I always tell people, go with a firm mattress. You can always soften it up by putting the cushion on.
Yeah, the mattress topper.
But you can never make it more firm. So that's good. At least somebody listens to me. suction on that. Have you been icing it?
I try to as much as I can. Oh, this feels so good.
Good. Yeah, I had a 85-year-old patient in the other day, and I was doing this type of cupping on her, and she was so cute. She's like, I sure hope somebody does this for you.
You know what my grandma told me the other day? She's like, you know what I realized? No man has ever kissed my feet. I was like, why are you telling me this?
Grandma. Parental advisory here. I have no idea how the conversation went from chiropractic adjustment to grandma's foot fetish.
She's like, that's on her bucket list now.
Well,
It's like, okay, grandma.
there's a lot of guys that like feet, so I'm sure they would love to kiss your grandma's feet.
I think that's how the conversation started.
Oh, that is so funny and odd.
Yeah. I was like, Grandma, I don't think I can let a guy do feet things on me. And then like she just like stopped and paused, and she's like, and I was like, what's wrong? Why are you getting mad? She's like, I've never had anybody tend to my feet. I was like, okay, girl, make this about you.
There's a website for everything. Grandma wants her feet kissed by young, hairless man.
Aww. Oh, that lady.
Oh, that is so funny. I have no idea how the conversation went from adjusting to grandma's foot fetish. It's wild to think that so many stories can come out of patients, and I don't know if it's because I'm releasing endorphins or what, but oh my gosh, I sure hope grandma does get her wish.
That's so cute about your client though. So if she's 85 and you're doing this method, do you have to be a little bit more careful with her skin?
Actually, strangely enough, she does not have crepey, elasticy skin. She's,
Wow. Yeah, because at work we, like, especially when we tape the eyes after we put the patients to sleep, with older patients we do paper tape.
Yes, and I think that the arms, the chest, the face, there's definitely certain areas that the skin is more crepey and thin. So Kimberly asked a great question. Do I have to be more careful when I do cupping on elderly people because of their skin being a little more thin and sensitive? The answer to that is yes. And why that is because the cupping will pull all the inflammation to the surface, and we don't want to damage their skin. So I tend to use the lighter cupping on my older patients.
I'm glad it's the left side and not the right side.
Why is that?
Well, because one of the workouts at CrossFit was ab mat sit-ups.
Mm-hmm.
So there's like a mat underneath, like right where you're at, and you do sit-ups. So it caused like a rug burn kind of effect.
No.
Yeah.
Ab mats, sit-ups. Are you sure that's how you got the rug burn?
I wish. I wish.
So what I'm going to do is I am going to, that's what I was going to tell you, put your hands on the floor. Okay. Alrighty. Breath in and out. Okay. Your chin's not hitting any metal. Okay. Another one. And out. You're getting releases, but they're not super big. Bend your knees for me. Breath in. Breathe in and hold. Okay. And down. Still off. All right, I'm going to bring you upright.
Okay.
All right, so it's your left side that needs to go in. So I'm going to start with you laying on your left, and I'm going to put your right side in first.
Okay.
So we'll go this direction. Hard to move.
Yeah.
All right, big breath in. Look over your shoulder and down. Nice. We'll do the other side. I'm going to have you look over your shoulder and breathe out. All right, I'm going to do one more for your sacrum. I'm going to roll you over a little deeper. And out. Feels so great. Flat on your back.
Oh, it just cracked right now.
And bend your knees. And go ahead and just rock your pelvis back and forth. Good. Is it painful going forward or back?
Forward.
Okay. Don't go so deep in the movement then.
Okay.
Just
do
a little softer, just to get some flexibility in that joint. Specifically with Kimberly's low back issue and having a chronic problem, the exercise that I want her to do is pelvic tilts. And with the pelvic tilts, a small little movement forward and back in her pelvic helps relax little intrinsic muscles that tend to spasm. And when she gets the looseness back into the muscles, it will help alleviate the pain. Are you stretching out your piriformis muscle?
No, I'm pretty bad at stretching.
Okay.
Yeah.
We'll have you straighten your legs then. We're gonna do both sides, so bear with me.
Okay.
Put that right there. You okay?
Yeah, it was already tight.
You're like, wait. And where are you feeling it? Okay. Did you just work out?
No. No.
You're like, I'm just that sore all the time.
Oof. I worked out yesterday with my trainer.
Okay.
So he had me go heavy. Oh my god, I need to go to yoga.
Kimberly's issue is mainly on her left side, but when we do stretching, we always do both sides. It's very important to keep both sides of her body functioning and moving as properly as possible. So when I did the Piriformis Stretch on her to release the muscle that is across her glute that the sciatic nerve pierces through, I always do both sides. Where are you feeling that? Good. But you don't feel it in your low back in that area. Perfect. Okay. I mean, you're paying your trainer, you might as well have him stretch you. Right?
He's gonna be like, Your chiro is crazy. I'm not going to do that.
Okay.
Oh, that felt so good.
Now I'm going to have you raise your right leg to my hand and down. Do you have any pain in your low back?
Mm-mm.
Your left leg to my hand and down?
Mm-mm.
Okay, good.
That was better.
All right. I'm going to traction your neck. Put this under your neck. Down. I'm going to just start with a good stretch. Any tightness?
A little bit, but it feels good. Oh.
When I traction Kimberly's spine, I'm decompressing her whole spine, which basically feels good. Life is so compressive that it feels nice to get a little decompression every now and then. So that helps with her low back. Yeah, feel that in there. Let me stretch it out for you a little bit.
Okay.
Oh my goodness. What's going on? Okay, let's see which one we need to get first.
Oh.
You feel it down there on the
Yeah.
left? Right there?
Mm-hmm. Hmm.
That's a good one. So I see a butterfly tattoo on your arm, and I was watching a movie yesterday, and in the movie they're saying what the butterfly effect is.
Mm.
And are you familiar with that?
Is it like a butterfly like flaps his wings like in the
Yes.
Amazon and creates a hurricane?
And I was like, what? So that reminds me of the human body, you know, how every little thing is connected.
That's true. Oh, that's so true.
And how your neck could be affecting your low back and vice versa. And
Okay.
that's why we're dealing with the whole entire picture.
Oh, wow. That would make a lot of sense, actually. Because this week I was doing a lot of like shoulder work too, so I was lifting heavier to work out my lattice. Yeah.
Okay. So let me adjust your shoulders too then. All right. I'm going to place my hand underneath your scapula.
Okay.
Bring this baby up. Gently couple it right there.
Oh, that felt good.
Yeah.
Oh, that felt really good.
Like I have freedom in my shoulder.
Yeah.
It's a ball and socket joint?
I didn't know. I thought it was just being held together by paper clips.
That one's tight. So, let's see your wrists. Relax. Elbow. Alright, you're going to be sore a little bit. It's going to take some time for everything to let down. So why don't you just step right over here. Can you flex forward for me and see if you can get a little more?
Yeah. Oh,